wearing a mask is they take it and put it here, it will be like this. This is not a mask at all. Your still nose is open. You need to actually take it, put it here. There's a small sort of reinforcement here. You should press it after you wear. Then it goes here, and you have to close. So this is where you need, and you should not touch.
Hi guys, this is Minitwan and you're watching HealthSite.com. Today we have with us Dr. Chandrasekhar, HOD Pulmonary Medicine, DMJ Hospital, Bangalore. Hi doctor, how are you?
Hi Mini, how are you doing?
I'm doing great and I hope things are keeping well in Bangalore as well.
Yeah, greetings from Bangalore. They're doing fine, except that the fire is spreading. Omicron virus, it has devastated us for so long, and it has made everybody's life topsy-turvy. And I don't know when we are going to totally recover from it.
That's true. I think all of us are sort of suffering because of this danger that's going on in the country. Having said that, since we're talking about COVID, Omicron, how has it really affected asthma patients in particular?
Definitely, the COVID, I would put not Omicron, you had Delta, Omicron, all those variants. So earlier we used to have the seasonal flu, influenza. It's become a part of our life. In 2010 years back, we had the swine flu, H1N1. All these are all basically respiratory viruses. Any respiratory infection or a virus will trigger or worsen an asthmatic symptom. That is there, it's not something new. But what COVID has done is that it's a little more severe in terms of aggravating the existing problem. Those people who had a very mild problem or in between they're free for a couple of years, they come back with the worsening problem. The problem should go away, the symptoms should go away in a week or two would take longer to subside. Those who are well controlled, moderate severe asthma also actually experiencing worsening of their symptom with the COVID. In fact, studies have shown those who have uncontrolled moderate to severe asthma are at a risk of catching the virus, one, and they also suffer more in terms of hospitalization, ICU care, etc. So this is the picture. So it has impacted the asthma. Not only asthma, it has impacted any chronic respiratory diseases.
Okay. But doctor, the air is such that we are surrounded by magnum of diseases at the same time, currently specifically. So people are also facing breathing issues in general in terms of, how can one really differentiate the symptoms as to, is this a COVID symptom or are we generally facing any breathing issues or is it the asthma that's, taking its peak? How can one really differentiate?
So if you really look at asthma, we have multiple triggers. One is like an indoor or outdoor. Somebody who's cleaned a house or exposed to some paint, smells, renovation at home, handling old blankets and things like that. That as an indoor trigger. Outdoor, of course, air pollution, everything that we know. These are the triggers of asthma, including the viral, especially children. Virus is the one which triggers asthma, not only children, in adults as well. This we know for many, many decades. Similarly, coronavirus, in asthmatic, you have two things. They also have increasing breathlessness and cough, which is a common symptom of corona as well. But in addition, they have this viral respiratory symptom like sneezing, running nose, stuffy nose. And in COVID, of course, in the earlier phases, we used to say loss of smell, sore throat, abdominal symptoms, which are not common in asthma. Unless we test, most of what we are facing in this third wave is anybody is a suspect who is coming with cold, running nose, feverish, and also whether they have existing asthma or COPD, we have to suspect because we don't know who is suffering, who is not unless we do the test. We will not know purely based on symptom. I cannot say this is no COVID or this is only asthma. So asthma is there, we have to treat it. In addition, any asthmatic coming with a fever and upper respiratory infection, abdominal symptom, we have to check for COVID to make sure they don't have. So by and large, if they don't have the fever, not much of a sore throat or abdominal symptom, you think it's mainly cough and wheezing, then we're likely to say this patient has asthma. But based on history alone, physical, I cannot really say COVID is not there. So sometimes we take a call and take a decision depending on how they are feeling, whether to test or not. But the way things are going, we need to probably any respiratory upper or lower, we need to maybe check the testing, do the testing for the COVID. Yeah.
Having said that, doctor, any do's and don'ts to keep in mind, specifically in winters and especially considering the COVID situation in the country right now?
I think you have enough on the media flooded with do's and donuts, but in general, use common sense. It's all the common sense about it. As I said earlier, what is the triggers? You know which triggers, which food will make your symptoms worse. You go and dust it. Like if your head is hard, you can't butt against the wall. Wall will not break, head will break. Similarly, with asthma is under control. Don't try to sort of go and dust old newspaper, books, blankets like that. That is no trigger. Similarly, avoid crowded places. And it's a neighborhood or your own niece or your kids who may have viral infection, don't go near them. As far as possible, avoid people with upper respiratory infection, avoid crowded places, always wear, again and again I would like to emphasize, a proper, I think it's become a sham. Wearing a mask, they take it and put it here, it will be like this. This is not a mask at all. Your still nose is open. You need to actually take it, put it here. There's a small sort of reinforcement here. You should press it after you wear. Then it goes here, and you have to close. So this is where you need, and you should not touch. Once you wear it, till you are done with your job, then you take it out, wash. So preferably discard, but it's expensive. It's easier said than that. Okay, this N95 actually recommendation is if you really wear it, you have to wear only for 4 hours and you have to discard. But that's not practical. Sometimes we reuse. But ideally speaking, when you're going into the wards, seeing the patient, all these people, we wear this N95, we discard it afterward. So do not touch. So that is how. Hand washing. So keep your sanitizer whenever you go. Okay, 100 times you wash, doesn't matter. Because the moment it goes near the nose or the eyes, it invariably gets into your upper respiratory system. So what happens is if both of us are wearing masks, I may be infected, chance of spreading, if both parties are wearing less than 1%. You take one person is not wearing, other is infected, chance become 30-40% of infection. So make sure that if somebody is not wearing a mask, keep distance, minimum 4 to 6 feet at least. Wear the mask, wash. This is general precaution. The triggers which people with some kind of acidity foods, which they know will worsen their acidity, is also first. So good amount of adequate nutrition, fluids, and the foods which they know trigger, avoid it. And things which trigger like perfume, scents, etc., which they know they should take. This is all common sense. But for COVID specific, avoid crowds, avoid contacting person with a fever or upper respiratory infection. Wear mask, hand hygiene. These are the basics which has not changed, whether COVID wave 1, wave 2, wave 3.
Well, I think that's a good sum up, Doctor. I think this has been really insightful for all our listeners. So thank you for joining us today.
Thank you. Bye.